Hi, my name's Emily Hanson, and I'm the owner of Hanson Insurance Agency. We're here to help you with all of your Medicare needs, from education to enrollment, and then we're also there after enrollment to help you when you have needs. Why is that important? Because you probably will need help later. If you call a number on TV, if you call a number on Facebook, those people are there for the enrollment only, and they're not local. They don't know the doctors in your area. They don't know what plans they accept. They only know what they see on the computer. And oftentimes that's wrong, unfortunately. So it's great to have somebody local to help you. Now, what I want to do today is, first of all, introduce you to the agency. The contact information down below will allow you to reach myself as well as any of my agents. The website, you can book an appointment for yourself at your convenience if you would like, with myself or any of my agents again. The telephone number is the same. It will reach my admin, Katie, and she will make an appointment for you. Before we get into the benefits and costs, etc., of Medicare, I want to make sure you know we don't charge for our services. The reason that's good is we are paid commission on the back end. We get paid the same whether we put you on Medicare Advantage, PPO, or HMO. Medicare supplements, it doesn't matter what you choose, we can offer all of it to you, and you don't have a cost. Now, if you do something on your own, if you figure things out on your own, you pay the same price as if you allow us to help you. So the way that we make money is commission. When you allow us to enroll you in a plan, we then get paid a commission from the insurance company. But then what's really great about that is you have somebody in your corner when you need help. So you have a broker, which is what we are. We represent many carriers, all the major carriers in your area. So please keep this information on hand. When you need us, we're here for help. We don't mind answering emails, phone calls. When you have questions, that's the whole idea, is I want you to be able to reach out to us and know that if we do not have the answer right away, we will research that and get it back to you, so that you can rest assured that you truly are in a good spot with agents that are going to be taking care of you. So let's get into the benefits and costs of Medicare. The ABCs, people call it the alphabet soup because there really are a whole lot of acronyms and it can be confusing, but we're going to try to simplify that today. Medicare is a federal health insurance. This is a program that people can get if you have been in the United States. You have to be an eligible US citizen, legal resident for at least the 5 years prior to applying for Medicare. It's funded in part by taxes that you paid while you're working. So the Medicare on your W-2, that's how you're paying for this. You actually have to have worked at least 10 years or 40 quarters to qualify for Medicare Part A to be premium free, and we'll get into that in a moment here. But most people, that's where you'll see that is on that W-2. It is an individual health insurance and not a family health plan, as it says in the next column there, which is great because I'm able to customize plans and coverage for you that are specific to your needs, not your spouse's. It's also not Social Security. So you can sign up for Social Security completely separate from your Medicare, depending on your financial plans and situation. Medicare is not Medicaid. These two get confused often. Medicaid is the financial assistance through the state. And you can have both of those, but they are not the same thing. And Medicare is not free. And many people think that it is. And we'll go over the costs that are associated with Medicare. Who can get it? As I mentioned, you have to have lived in the States for 5 years in a row. You have to be a legal resident before you apply. Age 65 and older is usually when people get Medicare, but you can also get it younger than that if you have a qualifying disability. You can also get it at any age with a diagnosis of end-stage renal disease or ALS. This is kind of what the Medicare card will look like. It does say Medicare health benefits across the top. It's red, white, and blue. Your name will be on the card as well as your Medicare number. Down below that, it will have effective dates for your medical and also your doctor coverage, which is considered Part A and B of Medicare. When you're first turning 65, you are in your initial enrollment period, or you'll hear people say your IEP. It's just your initial enrollment period. This period is 7 months. It's the 3 months before you turn 65, the month of your 65th birthday, and the 3 months that or after your 65th birthday, excuse me. Now, if you are already enrolled in Social Security benefits, if you're receiving those as you can start at age 62, then you will be automatically signed up for Medicare Parts A and B. If you are not signed up for Social Security and say you're just getting off of a group plan, or you've been on a marketplace plan, or don't have insurance at all right now and you're turning 65, you need to sign up in this 7-month window to avoid penalties. And the way that you're going to do that, the easiest way, is to get on ssa.gov. If you don't have an account, please get on there, create an account specific for you. You will be able to actually apply on the main page of this account. Click on Apply for Medicare. If you want to start receiving your Social Security at the same time, you're going to click on that, and it will actually allow you to sign up for Medicare as well as Social Security. If you don't want to get Social Security yet, that's totally fine. You can just stop at the Medicare portion, and it will say, do you also want to apply for retirement benefits? You just say no, and your application will be over. The other way that you can sign up is at a local office. They're open again. Since COVID, they were closed for a couple of years. They are open typically 9 to 4. If you stand in line, they will process it for you. It may take a couple of hours, so plan on that in your schedule. The third way is you can call 1-800-772-1213. That is the national Social Security number. Prepare yourself. Make sure you call earlier, meaning it's going to be 45-minute to 2-hour wait, and then they're going to schedule an appointment with you approximately 30 days out. So easiest way, ssa.gov. Any of my team is happy to help you do this. We will not just pick up the pieces once you have that Medicare in place. We understand the process to get Medicare is sometimes the hardest part. So let us help you with that. We've done it many, many times, and it's not a difficult process for us. We want to make sure that you enroll in the parts of Medicare that I will point out early. Enroll in those so you do not have any gaps in coverage. We don't want your group plan to end and then have a few months before your Medicare starts, or any other situation like that. We want you to be covered at all times. We also want to avoid late enrollment penalties. Now, during this 7-month window, you might refuse or delay your enrollment in Part B. You can also delay your Part A if you would want to. Again, I'm going to explain what the letters mean. The reason you might want to do that is if you are still working, or if your husband or spouse is still working and they have what is considered a creditable Medicare, creditable group health insurance plan. Now, that's according to Medicare, the word creditable. It means it's as good or better than what you can get through Medicare. You can also, at this point, once you have your Medicare, we have to have that first, you can sign up on a Medicare Advantage and a prescription drug plan and a supplement. Those are the 3 options that we're going to get into in a little bit here once we decide or go over the basic steps. Now, let me just move back a minute. We have 2 steps that are pretty important right now. The first step is what we're doing right now. This is your education piece. You need to know what you're getting and what it's going to cost you. The second piece, after you watch this video, please reach out and make an appointment with someone on my team so that we can talk to you individually. We need to be able to assess your doctor needs, what medications need to be covered, as well as your preferences for a health plan. There are so many options out there. We want to make sure that we get the right one for you. So 2 steps. 1, you're doing it right now. 2, make a one-on-one appointment. Those can be virtual, in person, at your home, or in our offices. We can meet at Starbucks, we can meet at your doctor's office, or we can do a telephone call, okay? Whatever's most comfortable and easiest for you. So getting into another list, what we're looking at right now, you need to get Medicare as far as this process. Get Medicare, and then second, you're going to decide what extra coverage you want. And that second step, you're going to do with your agent at your one-on-one meeting. We're going to go over the high level of it though, because I don't want you to feel like this is confusing. I want you to know there's really just 2 choices. Once we look down and just, hey, there's just 2 choices, it feels a lot simpler. So first of all, you've got to have that Medicare. So let's go over what is Medicare first of all, so that you know what you're getting here. Medicare consists of parts A and B. A is your hospital, B is your medical. Let's go into the specific financials of that though. Now, when I say Part A is hospital, of course it covers a whole lot of other little things, but the primary focus is that hospital coverage. This one does not have a premium for most people. So as I was mentioning before, if you have worked 10 years or 40 quarters and paid into Medicare, that's how you qualify for this premium-free Part A of Medicare. When I talk about hospital costs and hospital coverage, I'm talking about your room and board only in the hospital. So please keep that in mind. As soon as you're admitted into the hospital, you will be billed a deductible. This year in 2024, it's $1,632. Now that deductible will cover you for up to 60 days in the hospital room and board only. If you're still there after that, heaven forbid, you will tap into this $400 per day copay, is what they call it. A copay is a set dollar amount. A co-insurance is a percentage. So this is a copay, $400 per day from day 61 through day 90. If you're still in the hospital at day 91, you will tap into an $800 copay per day, and you are allowed up to 60 maximum lifetime reserve days is what they call this. So if you're in the hospital for 92 days, you'll tap into 2 of those lifetime reserve days, and then you'll have 58 lifetime reserve days left for subsequent visits to the hospital. The most concerning part about this whole slide for me is this N1 here, and note, no out-of-pocket limit. Your financial responsibility will continue to increase. Each time you go to the hospital, it will continue to grow. This is a per visit. So if you are in the hospital and then released a week later, and then you go back in a week later, you pay it again. And then these start to tally over and over. So that's Part A, your hospital room and board coverage. Let's go to Part B, like boy. This one is your doctors. So these are the doctors that see you in the hospital. They are the procedures in the hospital, the medication in the hospital. They are your primary care physician outside of the hospital, as well as every doctor outside of the hospital, the chiropractor, any specialist that you go to, the oncologist, even injections that are given to you through a doctor is covered under Part B, like boy, of Medicare. Now this one does have a premium each month. $174.70 is the normal premium for 2024. That is per month each. So if there are 2 of you, you will pay that each month. $174.70. The exceptions to that premium are people who are on Medicaid, and their premium is paid by the state, by the Medicaid office. And so they pay, it's a 0 premium. Now, the other exception are people who make more than the norm. And that premium can increase up to over $570 per month, depending on your income. What they're looking at is 2 years back, how much did you make? What was your adjusted gross income? And you can see what those charts will be if you just search IRMAA, IRMAA, and that chart, believe I've got it on here. Perfect. So this is what the IRMAA looks like right now. If you're single, you need to have made $103,000 adjusted gross income or less 2 years ago. So we're talking about the taxes that you filed in 2023 for 2022. If you are higher than that, you're going to pay an IRMAA, which is that adjusted premium for making more money than the norm. Now, come down here, this is somebody who's a little higher. That premium is going to go from $174.70 up to $244.60. Notice that if you have an increase on Part B, like boy, you also will have it on D, like drug. And please know that whatever your plan premium is, you will have to pay this increase amount as well for your drug coverage. That's something when you get to your one-on-one, we'll go over in more depth so that makes sense to you. So coming back to Part B, we've talked about the premium. You also have a deductible. This one is annual. Part A was each time you go to the hospital. Part B is annual. $240, you pay it once, and then you're done. However, after you pay that deductible, you then have 20% co-insurance, a percentage is a co-insurance. that you are responsible for. So Medicare Part B pays 80%, you pay 20% for everything that happens to you medically. Now in the hospital, this is 20% of any procedures, hip replacement, any doctor that comes and sees you, you're going to pay 20% of that bill. Every lab costs, every medication, and everything outpatient as well. Any surgeries that you have in the surgical center down the road, you pay 20%. Again, the most concerning part, no out-of-pocket limit. So this is where we look at it and say, okay, why do we have extra insurance? Clearly it is to minimize your financial risk. That's why I have a job. That's why I love doing this, is I like saving you money. So we're going to talk about how to save you some money with that extra coverage in just a moment here, but I want to make sure you understand a few other things that red, white, and blue card do not cover, and that is drug coverage. Drugs from a pharmacy, medications that you pick up from Walgreens or CVS, that's not covered under Medicare, under Part A and B. So we have to have a separate Part D, like drug plan for that. It also does not cover dental, vision, or hearing. So we need to think of other ways and other insurance to help cover those needs if those are needs that you have. So we have extra options. Now, this is where I'm saying you only have two options, really. When we're looking at it as a high level, there's only two options. It's actually pretty simple. So option one, this is a Medicare supplement plan. They're also known as Medigap plans. Medigap plans literally just fill in the gaps of Medicare. So what are the gaps? Well, the 20%, that's a big one. The deductible in the hospital, that's another big one. Those are the gaps that they will cover for you. Now, people turning 65 this year, or even a couple of years back, basically if you were eligible for Medicare before January or since January of 2020, the best policy that you can have is a Plan G. And I want to show those to you. Plan G is the best coverage that you can have with a Medicare supplement or a Medigap plan. It covers absolutely everything that Medicare does not cover, but it approves, except for the Part B annual deductible, which is $240 in 2024. So that's Plan G. Now, if you're older than, you got your Medicare, say in December of 2019, I can still get you Plan F. A lot of people think it's not available anymore. It is, if you're old enough for it. Okay, so Plan F even pays the Part B deductible for you. Now your premium is going to be higher, but it is still available if that's something you want, and maybe you've been working and you're now ready to get onto Medicare. If you're just turning 65, Plan G is the very best option. Now, what I mean by it pays everything that Medicare does not, as long as it's approved, Medicare has one network, one, I guess what pre-qualifier. The doctor has to be contracted with Medicare. So you go to your doctor and say, hey, doc, are you contracted with Medicare? If they say yes, they will take your supplement. They do not care what company it is. Now, if they do not take it, your supplement will not help you either, because it has to have first been paid by Medicare in order for your supplement to work. So the other question is my procedure that I need done covered by Medicare? If so, your supplement will pay the balance of it. So if you have an 80% surgery, they're going to pay the other 20% because Medicare paid the first 80. If it doesn't, if that Medicare does not cover the procedure, if it's an experimental treatment, or if your doctor does not take Medicare, this will not help you. It has to be those two together. Now, the other side of things is if Medicare doesn't cover something like drugs, dental, vision, hearing, then neither will your supplement. Okay, so these are like best friends. They do everything together. They also don't do everything together. So keep that in mind as we're going through this. So one other thing I wanted to point out on this screen before we move back to our options, Plan N is the next step down. So we have F is Mac Daddy, best plan out there. Plan G, one step down, only have to pay the $240 annual deductible, or whatever that is going to be next year. It will increase. This one, Plan N, exactly the same as Plan G, except you have this little asterisk. That is a $20 copay to a specialist, so anyone other than primary care. And it is also a $50 copay for the hospital. The one other thing that it adds down here is you have the possibility of being billed a Part B excess charge by a doctor or a facility. It's a 15% charge that can be billed if your doctor or your facility are not fully credentialed with Medicare. So you've got people who are completely contracted with Medicare, and they will accept payment as Medicare payment as payment in full. So you don't owe anything if you have a plan that they take in full, right? If they are not contracted over here, that's our other extreme, then your Medicare or your supplement, neither one will help you there, and you're going to pay everything 100%. This is not common. The ones right in the middle are the ones that I'm talking about. They are partially contracted with Medicare. It means that they're going to accept the money from Medicare, but they also reserve the right to bill you an extra 15%. These are the people that if you go to these kind of doctors, I'd rather you didn't get on Plan N because you will be paying that 15%. It's not common. I've actually never had one of my clients get billed that 15%, but I have to make sure that you understand that that is a possibility. The rest of these, carriers can offer these. They don't have to offer all of them. There are some that are required, some that are not. They have high deductible, say Plan G or Plan N. So when you do the one-to-one with us, we can go over and exactly find the plan that you prefer the best. So moving back, the supplements can be many different insurance companies, and they are. There's a lot of different companies that offer these. So again, we're looking at option 1 on the red side, the Medicare supplement option. You have Medicare. You're going to have your Medicare that you pay a premium for that each month. And by the way, that premium is going to come directly out of your Social Security check if you're getting it. If not, you're going to get a bill in the mail. Usually it's for 3 to 4 months at a time. So make sure you look at the dates when you see the large number on there that you're expected to pay. If you want to pay that each month, you need to create an account on Medicare.gov and set up auto pay from your checking account. But if you want to choose to pay the chunk at a time, you can get on Medicare.gov and pay with your credit card. So if you get points, that might be a good way to do it. Just please make sure you get that paid. I've seen way too many plans canceled because the Medicare, they've forgotten to pay. So Medicare supplement option over here. Now, these are not contracted Medicare plans. They are private insurance. They can do what they want. And the reason I mentioned that to you is you have an open enrollment 6 months after you turn 65, or if you've waited until, say, age 70 or whatever to get your Medicare Part B, it is 6 months from when your Medicare Part B is effective. And during this time, I can get you whatever plan you want at the best price because they're private insurance. They can do what they want. And so you see different prices across the board. Now, these also will increase every year their premium. You can count on it. So what we want to do is not just look at that starting price. We also want to look at, okay, which ones increase like this, which ones increase like this, because as our income, really gets like this in retirement, we don't want this kind of an increase. We want to be able to know what to expect. After the 6-month period, we will have to answer health questions. So if you have concerns about your health, if you have conditions that are going to be very expensive to treat, we want to make sure we get you onto one of these plans if that's what you want, right when you have your Medicare started. All right, coming back here. Now, still on the red side, almost done with this one, I promise. Medicare, separate premium, separate card for your Medicare supplement. It is called a supplement. The other side that we're going to talk about, those are not supplements in Medicare's eyes, okay? This is a supplement. When someone says supplement and it's legitimately Medicare supplement, this is what we're talking about. Plan A through N, not a Medicare Advantage plan. So you'll have a separate premium, separate card. This also, you can change throughout the year. So if you're in good health, you're able to answer the questions and maybe you get a premium increase and you're concerned about, oh my gosh, that's really increased so much. Well, if you're in good health, we can definitely shop around at any time of year because they're private insurance. We can do whatever we want, right? They are not held captive, I guess, to the Medicare rules and timelines for making changes throughout the year. Now, Medicare Part D, that's why we've got that separate card down at the bottom. Your Medicare supplement and your Medicare are not covering your drug coverage. So we've got to have a Part D plan so that you don't receive a penalty, as well as, and by the way, when you get a penalty, that stays with you for your entire life. So we need to avoid it from the very beginning. And also, we want to make sure that you have drug coverage for when you need it. So these also will be a separate card, separate premium when you're on the red side. These are private insurance companies. These are contracted with Medicare. Okay, these are actually Medicare plans, but they're contracted through a bunch of different insurance companies. Okay, and the way that I determine which one's going to be the best for you is literally your medications, because they will cover them differently, that we'll get into in just a moment here. So let's jump over. We're going to talk about the blue side now. Remember, you only have two options. We just talked about option one. That's your Medigap or Medicare supplement. This one, you pay more money up front for, but on the back end, you're going to pay your deductible only if you have a Plan G, $240 this year. After that, everything that Medicare approves is paid for you. You're going to have the Part D, when you go to the pharmacy, you will have copays for your medications, a dollar amount or a percentage, depending on what tier, what level, what kind of drug we're talking about. But as far as medical things go, everything is paid for you on the back end, on the Medicare supplement option. So moving to option two, these are Medicare Advantage plans. Medicare Advantage is also known as Medicare All-in-One plans, because they literally just puts everything into one card. They're also known as Medicare replacement plans. Although they don't replace your Medicare, you have to have Medicare to even get them. But what they mean by that is they become the payer of your bills. So rather than a doctor's office billing Medicare, they're going to bill the insurance company that you have your Medicare Advantage plan with. They are also known as, let's see, Part C. So because they literally are Part C of Medicare. So we have Part B up here. We have Part D down here on our red side. And what happens is you bring those two together and you've magically got Part C of Medicare. These are the Medicare Advantage plans. It's all the same thing. You hear so many different terms. It's one thing, Medicare Advantage Part C, okay? Part C plans are contracted Medicare plans, just like Part D is. Now, Part C plans can have drug coverage. Some of them don't, because maybe you get your medication benefits through the VA, or you get it through TRICARE, or maybe you have a really big penalty for D, and sometimes you don't want to incur that penalty or pay it. And so you can take that out and not have the drug coverage if you want. Most people need it and have that in their plan. These plans are funded by Medicare. So in two ways. One, they're funded by you, really. You pay your Part B premium up here. And when you have a Medicare Advantage plan, that amount that you paid gets transferred down to the Medicare Advantage plan that you choose to help take care of you. So that's why these plans are now responsible for paying your bills rather than Medicare, even though they are Medicare plans, okay, the Medicare Advantage. Another thing is these are funded by the federal Medicare fund. So they receive money every single month to take care of you. Now, that's how they're able to include many of the things that you don't see on this side with Medicare supplements. You have dental, vision, hearing. Many plans have over-the-counter benefits, such as a credit for things like vitamins or ACE bandages, adult underwear. There's a lot of things that you can get with those kind of things, canes, walkers. Some of these plans also include transportation, gym memberships. There's a lot of stuff in these plans. They're pretty darn great. And that's also how they're able to give you a plan that many of them are no cost to you. So you always pay that Part B premium, but then these plans either are zero or a really low premium. So let's talk a little bit more about this. This right here, take a screenshot of it. I'm not going to go over it too much, but if you are still working and you are wondering, do I need Medicare? These are the questions that I want you to ask your health benefits coordinator or your human resources department. Once you get these answers, send them over and someone on my team will evaluate and give you a response as to, you're fine, stay right where you are. You don't need to have anything until you retire. Or, you know what, this is a really expensive plan. We can actually help you and give you a better coverage, better benefit structure, and maybe a lower premium on the individual side. Okay, so hopefully you have all that there. If you need any clarification or on these questions, please let me know. What I want to talk to you about now, drug coverage. We're going to have some big changes with drug coverage this year. So whether you choose the red side, Medicare supplement, and you have a separate Part D plan for your drugs, or the Medicare Advantage side, and your Part D, your drug coverage is included in your Medicare Advantage plan, either way, we're looking at the same basic structure of your drug coverage. Now, with group plans in the past, you've always had your deductible and your maximum out of pocket that include both your medical and your prescriptions. It's not like that anymore with Medicare. They're separate, okay? So your medical portion might have a deductible, and it definitely has a maximum out of pocket for a Medicare Advantage plan. That's one huge benefit that I haven't mentioned yet. You do have a maximum responsibility. So if you have the worst year ever, you pay up to X amount of dollars depending on the plan, and then everything is covered for you medically after that. You have the similar situation with a drug plan, but they're separate calculations, separate numbers. So with the drug plan, every single company, whether it's a Part D or Medicare Advantage, they come up with a list of the drugs that they are going to cover on that plan. They're required to cover at least one per illness class, but they don't have to cover all of them. So that's, again, my job, your agent's job, to make sure that we find the plan that's going to take care of your medications and your doctors the best. So what this list of drugs is called is a formulary. So if you hear that, that's what we're talking about. You have 5 tiers typically, sometimes 6 in Medicare. That's another thing that's a little different from group plans. Tier 1, Tier 2 medications, those are called generic medications. Most medications do have a generic equivalent. If you can get that, if you can tolerate it, that is by far the least expensive option for you. Tier 3, those are brand name medications, and also insulin is on this tier on most plans. Tier 4, those are non-preferred brand name, obviously getting a little more expensive. Tier 5, these are your oncology medications or your specialty medications. They're pretty expensive, as you can tell by the $5 signs. Now, deductibles, which is a total dollar amount that you have to pay before the plan covers you, they are charged by tier, but some plans have them, some plans don't. In some plans, if they have it, they'll only charge that deductible on, say, medications on tier 4 and tier 5. So anything that you have on tier 1, 2, 3, you wouldn't have a deductible and they would cover it right away. So that's something that we'll go over as we're working one-on-one with you. Now, the next screen I'm going to show you will change drastically next year in 2025. So we'll go over this. Keep in mind, this is for 2024. If your plan has a deductible, you'll pay that first. The max that you can have on a plan deductible this year is $545. So if, let's say you have a medication on tier 4, you have to pay that $545 first, and then you'll have a copay depending on whatever that is for that medication on that plan. So it might be another $100, it might be $47, depending on the medication in the plan. So after you pay your deductible, it triggers you over to stage 2, which is the initial coverage stage. And that's when you're just paying that copay. So let's say Ozempic. That's one I see often. Ozempic is a starting dose typical price of about $900 per month. So when you get to this initial coverage stage, depending on the plan, you're either going to pay $11 for that medication, or you're going to pay $47. It's pretty typical for a 1-month supply of Ozempic. After you pay that for a few months, you'll realize something, that behind the scenes, they're not looking at the dollar amount that you're paying. They're looking at the total cost of that medication. So they're adding up the $900 every single time you buy Ozempic. So it's 900 plus 900 plus 900. And then maybe you need some lisinopril or a atorvastatin. Those are really inexpensive, but the total price is still going to go into our calculation. So you might not pay anything for that, but $10 here, $20 there, until you should get to this $5,031. Once you get to that amount of total drug costs, not what you pay, not what the insurance company pays, the total cost, that triggers you into the third stage of drug coverage with Medicare, called the donut hole and the coverage gap. Now, this stage you're in until your out-of-pocket costs gets up to $8,000. So we're not looking at the total price anymore. We're looking at what you have personally paid this year for medications. Now they're going to go back and say, okay, they paid a $545 deductible. They also paid a whole bunch of copays. Thank goodness they actually do give you a 25% manufacturer discount that they add into that calculation. Once it gets up to that $8,000 amount, then you are at your maximum out of pocket for medications. And then you don't pay anything for your medicine for the rest of the year. This is our first year we've actually had a max out of pocket in many years for medications. Next year, the donut hole is going away. It's been slowly getting smaller. Next year, it goes away. You can see down here at the bottom, individual prescription spend is capped at $2,000. This process always starts over January 1st. It's a fiscal year, it's a calendar year, cycle. Like it says here, most people never even get to this donut hole. Some people, their medication is so expensive that they get to this and fly through it in February. And other people, they're going to get to this donut hole and sit there for 6 months of the year. It just depends on your medications. And of course, that's something we're going to talk through in depth when I have those medications or my agents are meeting with you one-on-one. Now, when you're looking at that bottom line, it looks fantastic. And it is. It's going to help a whole lot of people. But we have to think about who's going to pay for the difference. So we are not positive yet, other than that most of that risk will fall on the carriers. And that means that the risk is going to come to us. Most likely next year, we're going to see higher drug plan pricing. We're going to see medications that probably are not on these formularies. I think formularies are going to get a little skinnier. There's going to be some benefits probably that we're going to lose maybe from some Medicare Advantage plans. There's a lot of speculation at this point, but what I want to emphasize is if you're getting on a plan right now for the rest of this year, please make sure that you reach out to us and that we do a plan review during the enrollment period coming up. And that's the next thing I want to talk to you about is when can we make changes? And that is in the Medicare annual enrollment period, October 15th through December 7th. That is when any plan that is contracted with Medicare, we can make a change. So that is your drug plan, your individual drug plans. If you have the option where you are Medicare, supplement, and a drug plan, or for some reason you just have Medicare and a drug plan, then we want to make a change right then. We need to at least evaluate it to make sure you're still on the same plan for next year. Because if you don't make a change and they increase your premium from 50 cents to $70 a month and you don't do anything about it, that's our only time they'll let us make a change. So we got to talk during this time, okay? And make sure we are really being careful and looking at your medications for next year. Medicare Advantage, this is also the time to make a change if we need to. Medicare supplements, remember, private insurance, they can do what they want. These we can change throughout the year. Now, as long as you still can go through underwriting. The next thing here is if you choose the option Medicare Advantage, we also can make a change January 1st through March 31st. We can go back to original Medicare and get a supplement if you can qualify for one and a drug plan. Or we can make one change only from one Medicare Advantage plan to another one. So this again is called the Medicare Advantage open enrollment. You can also make changes throughout the year if you qualify for a special enrollment period. Did you move? even a zip code change or a county change. Sometimes your plan is no longer available, or if you have new options available to you, we're able to make a change. If you have a special need that is developed, such as cardiovascular issue, respiratory issue, or you are diabetic, a new diagnosis, we can make a change for that. If you have financial assistance and you now have either something called extra help or low-income subsidy through the federal government, or if you get Medicaid through the state government, then that qualifies for a special enrollment as well. One thing on these special needs plans that I want to go back to, because I know I jumped past that one. We have 3 different kinds of Medicare Advantage plans. So that's this option here was option 2. Option 2, you can either get a HMO, which is a health maintenance organization plan. These have some of the richest benefits, and a lot of people prefer them. These plans, you have to stay within the contracted doctor network. So if you go outside of that network, you won't have any coverage unless it's an emergency. And these Medicare Advantage plans do cover you if you ever feel your life is in danger, if you are in the US or outside of the US. Medicare itself does not cover outside of the United States at all. A supplement has limited coverage outside the United States. It's typically a $50,000 limit. Medicare Advantage plans will have a copay, some of them zero, up to a certain amount of emergency coverage only. These plans, most of them, you will need to have a referral. The HMO plans, a referral from your primary care doctor to see a specialist. Again, they have the richest benefits though. So if what you're looking for is, you know what, I don't even travel anymore. We're set in our area and I have my set 2 doctors that I ever go to, and I'm totally fine if I need to get a referral from my doctor and I need the best dental I can get. Well, I'm gonna put you on an HMO. We're going to look at those benefits and compare everything, and each plan offers different things, and we'll choose which one's going to be the best for your situation. Now, if you're somebody, you're still traveling, or you really do want more flexibility, we're going to look at a PPO, Preferred Provider Organization plans. Most of the group plans that you'll be coming from are PPO plans. You do not need a referral for these plans to see doctors within the network. That means they're contracted. In-network means they're contracted. Out of network, which you can go to with a PPO, it will just cost you more. You need to make sure that those doctors do take Medicare. If they're in network, that means they are contracted with your specific plan, whether it's United Healthcare or Aetna or Humana, you're contracted with that exact plan you're on. That means they're in network. Out of network, as long as they are contracted with Medicare, they can bill out a network typically for you, or you can submit a claim to the insurance company. You're going to pay a little more to do that though. These plans, greater flexibility. Many of them now have national networks, which is really great. You can see doctors in many other states for the same cost as you would here in your home area. So those are becoming easier and easier to use, and a lot more flexibility. And also, these are the plans, many of them are still $0 premiums. So you literally don't pay anything for your premium in addition to your Part B that you pay to Medicare. The third option for Medicare Advantage plan types are called special needs plans. And you'll see it as SNP as well. So these are anybody who has a chronic disease. And that is, as I mentioned, respiratory, cardiovascular, diabetes. Those are the 3 that are right now considered chronic diseases, although there are so many more. Those are the ones we specifically have plans for. End-stage renal disease is also a plan that is offered specifically for that. Now, another kind of special needs plan is if you do have both Medicare and Medicaid. They're called dual special needs plans because you got both of those, Medicare and Medicaid financial assistance through the state of Texas, Tennessee, wherever you happen to be. Those are wonderful plans as well. And then the third option here is if you're institutionalized, those are called ISNP. So ISNP plans, institutional plans. Depending on your situation, each plan may be, one would be the better for you over another. And if you're working past 65, You do have, say you finished your work, you're done, your employment ends, you have an 8-month enrollment period to sign up for Medicare. And then you have only 2 months. The overlap, lack thereof is frightening. 2 months to get on a Medicare Advantage plan and a drug plan. And so if you're working with us, I want to talk to you before you actually retire, please, or within that first month or two. So these are people who delayed your enrollment because you had insurance. One last thing, if we miss this enrollment period that we mentioned in the very beginning, it was the 7-month enrollment period. If you miss that, and I'm just going to go back to it because I want to make sure that you guys know what I'm talking about. Right there. If you miss this and we do not have group insurance, you're not going to be able to sign up for Medicare again until the following, they call it open enrollment period, another acronym, OEP. And that is January 1st through March 31st. It'll be effective the next month, thank goodness, but you're not going to have coverage during that time. If you miss that period, you have to wait again until the next year comes around. And so we don't want to do that. The point is, let's do this early, make sure you get an appointment with us, and we can help you map this out so that you know exactly the timeline we need to go for, so that we don't have a late enrollment penalty for Part B or for Part D. Late enrollment penalties for Part B are accrued on a yearly basis, and that is 10% per year of the premium cost. So if you're going to pay $174.74 your premium and you have only 1 year late, each year it's going to be 10% of that. So it'd be 174 is 20. Yeah. So it's going to be around $18 more per month for the rest of your life. Some people don't do this for about 10 years. So clearly it's a much bigger premium that they're paying. So we want to get this done on time. Same thing for the drug coverage. That one is calculated per month. It's approximately 35 cents per month as of 2024. So every single month that you didn't have drug coverage that they say you should have since you turned 65, they're going to assess this penalty and charge it to you every single month. So again, let's start early. Let's make sure that we get everything taken care of so that you're not stressed out. And we want to just make sure you don't have to pay any more than you have to. So guys, this is everything. Please make sure you get on right now, schedule an appointment with myself or someone on my team so that we can do step 2, which is evaluate your medications, your doctors. Let's make sure you're on the right plan from the very beginning. Thank you so much. Have a wonderful day.